So welcome to Explore Careers in Healthcare, January 26, 2021, where we talk about career pathways. We know that in the healthcare careers, there's a lot of options to start in a location and then gain and stack training and experience and move up the ladder. So I'm so glad to have all of you here. As you may know, this month here at Career Force is Healthcare Month. We've been celebrating, learning, exploring all of the different options within the healthcare industry throughout the state. I asked the question of all of you, what have you learned? What have you discovered? And there certainly is so much more to discover, as we are going to today with Career Pathways. But at any point, in the coming weeks, you still may go to careerforcemn.com/industry/health-care. We've got a subpage within the website devoted to the healthcare industry. Today, we've got another great lineup of speakers. I've so enjoyed working with everyone over the past month. We'll first hear from Care Providers of Minnesota, Minnesota's Association of Long-Term Senior Care Industry. She'll tell us more. We will hear from Minnesota Department of Veterans Affairs. We will hear from rural Minnesota Sep in the northwest area of Minnesota. And then we will hear from two other facilities, Tealwood Senior Living and Jones Harrison Senior Residence. Tealwood has locations all over the state, and Jones Harrison is focused in Minneapolis. But first, I'd like to invite Nicole Matson of Care Providers to set the stage for us. Tell us a little bit more about career pathways and the healthcare industry. Welcome, Nicole.
Thanks for having me, Liz, and hello to everybody. Hopefully I don't have too many computer delay issues here. Hope everybody is well. I'm Nicole Matson with Care Providers of Minnesota. We are a state association of senior care providers. We have over 900 members throughout the state, representing all sorts of continuum in the senior care world. So skilled nursing, assisted living, home care, and other senior care providers. My role here is Vice President of Strategic Initiatives, and that includes some advocacy and workforce. If you could go to the next slide, Liz. So really excited to talk to you about careers in senior care. When Liz asked, what have I learned? I've learned that I love our profession. I think it has a lot to offer. And I think most people know about kind of some of those clinical ladders, and we have those. Those are inherent to all healthcare realms, I guess. But there's also other ways to contribute in the senior care field. There's many different positions, be it those caregiving positions, direct caregivers, home health aides, personal care attendants, universal workers, some of which you don't necessarily need a certificate. It's a good point of entry. There's also a waiver right now, which allows people to enter into our field as a nursing assistant who are not on the registry. That's kind of a temporary waiver. There's roles within housekeeping or environmental services. There's roles in food production and food delivery services, culinary services, and then nursing. Nursing assistants, licensed practical nurses, registered nurses, trained medication aides, that more clinical side of caregiving. If you could go to the next slide, Liz. So really what we wanted to talk about today is the career progression opportunities. Like I said, there's many points of entry, some of which don't necessarily require any experience or background or certification or education. Many employers do that training themselves, on-the-job training. And now for skilled nursing facilities, there is a waiver that's in place that allows nursing assistants who are not on the registry to get hired, trained, with the anticipation that the end of this, and hopefully there's going to be an end to COVID at some point in time, we will be able to get that person trained and on the registry by passing the state exam. Some training, nursing assistant training, for example, is completely reimbursable by the provider. So we will pay for that. Some people pay up front. Some people enter into our field as already a fully fledged nursing assistant, and then we reimburse them for their out-of-pocket cost after 6 months. Some enter in as a dietary aide or a housekeeper and then decide that they want to move up that ladder into a nursing assistant role. So there's lots of different points to kind of enter into our field. And then once you're kind of in, there's a lot of different pathways, right? There's those clinical pathways that many people are familiar with, and kind of a typical pathway is that nursing assistant who maybe then gets some additional training to become a trained medication aide so that they can pass medication. And maybe they really find that through that experience, it resonates with them and they want to continue on and get licensed as a nurse, become a nurse, either a licensed practical nurse or a registered nurse, and they want to go on and get some education for that. But there's also leadership opportunities with management, or other kind of non-clinical leadership roles. And then I guess this is something that I want to talk about too. Life happens in our settings, right? So it's different. So anything that you can think of as far as a well-rounded, holistic, good life, that's going to be some activities, that might be some spiritual care, that might be other kinds of services and supports to support that person as an individual. There's roles within those departments or those areas as well. And then one of the things that really sets us apart in healthcare is that support for growth and development. My own story, I started as a dietary aide and kind of worked my way up through the organization in many kind of like office roles, and then went to school for human resources. Worked as a human resources director, and then sought licensure to become an administrator. So then was kind of like an executive director administrator role. And now I work for a state association. But there are opportunities all throughout our settings for that kind of growth and development. I think that's one of the things that sets us apart is we invest in our people. Because a lot of times once you start working in senior care, you don't want to leave. So we need to have those ladders, those opportunities for growth, and support that. And it kind of has become our competitive advantage. And with the ladders, I want to also stress, and I think I've seen some comments in the chat, there's a full lattice. Like I started as a dietary aide and kind of did a pivot to office work. Somebody might want to start as a nursing assistant and decide that activities really resonates with them and they want to do something as a therapeutic rec. Or maybe it's something like physical or occupational therapy. There's a lot of different kind of ways to go and opportunities there. If you can go to the next slide. So this just kind of illustrates what that ladder is all about, that there's lots of different points of entry and lots of different places to go. And what's kind of unique about the environment is the ability to investigate and see what those other career paths are like, while still having a job that's meaningful and fulfilling and opportunities to give back. But I think we're really open about, letting people have entree into new departments, new areas, so that they, does it resonate with them? Do they like that? I think that would be, again, something that kind of sets us apart. I mentioned I want kind of a human resources, business, healthcare administration track that's on the ladder here, but there's other, social services, hospitality, nursing, recreational therapy or activities, and gerontology. If you go to the next slide. So I wanted to, again, this is part of my, what I want to emphasize is what's different about long-term care. First, the work itself. I think it's different than acute care. Life is happening. Every day is different and unique, but you really get that opportunity to develop a relationship with the person that you're caring for, resident, client, patient, whoever, whatever title we want to give that. But and then if nursing or that clinical realm is where you want to be, the experiences in our environment can be just as robust and just as varied as in an acute care setting. There's a lot of opportunity to learn and be challenged. And again, I mentioned too, the work is very meaningful and rewarding. You get to be part of someone's life and help them with their independence or help them rehab to gain more independence. So this is the kind of work that really resonates with people that are service-minded, people that want to engage in that mission-based healthcare and the opportunity to be part of someone else's life. The workplace is also different. We talk a lot about job quality these days. What is the job quality? Long-term care employers really make that investment in people. It's a people-heavy industry. We know we can't do this work without people. And if we see an opportunity to promote someone through education or career advancement, that's just something that's inherent to our environments. That's what we do. We have scholarships and loan reimbursement to make that possible. And many, many providers really leverage those scholarships and encourage people to pursue education that will further their career in long-term care. And again, that support and that encouragement. Anytime, really any healthcare environment, I think you go through this where you kind of go through the trials of working through someone's life. You just and being in service to them, and it brings up a lot of scenarios where you just become further attached to your coworkers, right? Because you've lived and breathed and gone through like something like COVID together, and that teamwork and that passion that develops. I think it really makes for a supportive environment. So again, just those people first. That's what's different about long-term care is people first. Patients might be a diagnosis in an acute care setting, and to some extent, we're talking about diagnoses as well, but it's more than that. It's much, much more than that. So one of the things that we did early on in the pandemic was realize that some professions might not be returning. And there was an opportunity to kind of passively engage with a lot of individuals who might be seeking employment in a new area, a new field. And what would that look like? And, how can we attract someone to our profession? So that's really what Caring Careers Start Here was born of, is trying to attract people to the long-term care, senior care profession, and the ability to kind of indicate interest. And then behind the scenes, we do some things to push those names out to our membership, both Care Providers of Minnesota and Leading Age of Minnesota. We represent virtually all of the senior care providers in the state. So there's a good connection point there. But Caring Careers Start Here also has information about what does a job look like? What's the rates of pay on average based on deed data? What do I need to do to become a nurse? So it's really a robust website that offers a lot of information. And we change it up a little bit to also act as kind of a career interest hub out of need of knowing that, a lot of individuals are seeking employment for the first time in our profession. So encourage you to check that out. And also I will put my name in chat if you have any questions, or if I can be of help to you in your job search, please don't hesitate to reach out.
Thank you. Thank you, Nicole. Yes, we have had a few questions coming in the chat. So just for the sake of time, I'll ask that if maybe, Nicole, you go through and address some of the questions coming in. We're going to move ahead, and I'm going to welcome Io Jones. She works for the Minnesota Department Veterans Affairs for the Minnesota Veterans Home. She's going to tell everyone about their Minneapolis home for retired senior veterans, but also, talk about all of the veterans homes across the state in case we have callers from other places on the line. Hello, Io.
Hello, can you hear me all right?
You're on.
Okay, thank you. I apologize. As soon as I got the hit for a mute button, it exited me out of the whole presentation, so I apologize. I didn't really hear your instruction. But I'm here representing the Veterans Home in Minneapolis, but also would like to touch base on some of the other locations that we do have. I specifically work as a recruiter, but I belong to the HR department, generally speaking. Go ahead to the next slide. So basically how the Veterans Home is different than some of our other long-term care facilities is that we pay attention and specialize in care for our veterans. And all of our residents are veterans and people who have served. Originally, the location in Minneapolis, the beautiful location near like Minnehaha Falls and all of that, was built for Civil War veterans. So it's been a long-standing establishment and lots of historical buildings are there. And it's a great place to take a walk, just even if you are interested in seeing what our facilities look like. Today, the Minneapolis campus offers a lot more different services specialized for the needs of the veterans. So some things to take note of are we have right now 291 skilled nursing care beds, and each of the floors are organized in a way that depending on what your needed for care is in association with dementia, you'll be in a different area. We have 50 domiciliary beds. And then also with COVID, there are some services that have been switched or paused for a period of time. So things like barber and beautician services, those things they still get access to. However, it's not just an open layout where people are walking around. It's more structured in our amount of movement that goes on to ensure safety for all of our veterans. We also have homes in other locations across the state of Minnesota: Hastings, Fergus Falls, Laverne, and Silver Bay. Those places have similar layouts, or it's not similar layouts, but similar cares they give. However, it's just localized to the areas that they need for those veterans. Next slide. I'm not sure how many of our people who are here today are located in the metro area, but when we talk about the Minneapolis home specifically, it's just gorgeous. I've been working there for about a year. Most of my time has been remote, so I haven't had the chance to really enjoy the surrounding areas, but it's extremely therapeutic for our residents because of the amount of greenery and outside and walkways that we have access to. And as it was said earlier, that a lot of the folks who decide to work with MDVA or the Veterans Home in Minneapolis really enjoy giving resident-focused care. For a lot of our veterans, this is the last place that they are going to stay, and it's a very therapeutic family feeling. Our staff are not required to wear scrubs. They have other requirements when it comes to dress code, but we want it to feel as close to a home environment as we possibly can because they will be there. The resident to staff ratio is one of the best in the whole state. Excuse me. And we also have a lot of flexibility when it comes to hours that we make available to our staff, whether that be part-time, full-time, intermittent time schedules. And depending on those FTE or time variables, you also have different access to benefits. And like I said, in the metro, we have access to, Metro Transit, which is a great selling point for a lot of our staff. So as I said earlier, pretty much in long-term care, a lot of us follow similar career pathing and similar opportunities for growth. Today, I wanted to just highlight and mention some of our positions that we are always looking for, just because we do have people who either promote within the agency or find that they are interested in another realm of work within long-term care. We call our CNAs human services technicians. They all are required to have the CNA certificate. So when it comes to being in an entry-level position, we really would suggest getting in through our food service worker classification, our maintenance worker classification, to potentially see if you enjoy the environment and then pursue your CNA. We do have reimbursement opportunities depending on your FTE and classification and department. And so just to quickly go through, as you guys probably are aware of now, since we're all in the realm of healthcare, we have LPNs, licensed practical nurses, registered nurses, food service workers. All of those positions are towards the entry level of our organization, and it goes all the way up to supervisors and administrators. And we have lots of people who have taken advantage of that and advocated for themselves within the organization to continue to grow, along with working with our HR department. So being that we are a state agency, you can go and apply to our jobs using the careers website. I just wanted to make sure I plug in that it is extremely helpful if you guys, anybody who's interested in a position, reads the position posting clearly, because as I'm a person who screens, we do screen with real humans based on whether or not it's perceived that you meet the minimum qualifications. So in the case of applying to a state job for the state of Minnesota, I suggest personally that you indulge in sharing all of the experience that you have related to the job you're applying to, and make sure that's written out on your resume. I don't want to overdo for time, but just so you guys know, on the website, we can really narrow down what your interest is, whether it be into dietary, physical plant, and or healthcare providers. People move laterally, people move horizontally, vertically. So yeah, I'm the person to get in contact with when it comes to some of our RN positions. You'll see a contact either myself, Io Jones, or my partner, Shamara Freeman. We both take care of the Minneapolis home, and if you have an outstate location, those names and contacts will be on those postings as well on the careers website. Thank you.
Great, thank you, Io. Yeah, the more you talk about how beautiful it is, I want to go over there someday in the future and take a walk around the area. Just to be clear, Io, answer the one question. MDVA does hire non-veterans for these positions, correct?
Absolutely. We do have an interest in hiring veterans, just because that's a protected class that we take a special attention to. However, you can be of any background and you will be considered depending on your classification and your meeting of the minimum quals of the position that's posted.
Great.
But if you're a veteran, yes, apply too.
Yeah, definitely. Good. Thanks a lot for being here. And I've posted the MDVA job line as well as Io's email address in the chat. And go ahead, Io, and answer any other questions that are in the chat there. But meanwhile, I'm going to introduce Kelly Noel, a colleague of mine within CareerForce. She works for rural Minnesota Sep, and she's going to tell you what those initials stand for. Hello, Kelly.
Hi, welcome everybody. And I'm up in Detroit Lakes, Minnesota, so I'm like a 3-hour drive northwest of you guys out here in rural country. SEP, Concentrated Employment Program, And as you can see there, we have 8 locations. We cover 19 counties. We have offices in Brainerd, Wadena, Bemidji, Little Falls, Alexandria, Fergus Falls, Moorhead, and Detroit Lakes. So we cover a lot of territory and work with many people. Some of the things I've already noticed that's okay, go ahead, Liz. In the previous 2 speakers is, wow, the history of how we've gotten to where we are today. I was working here back in the first recession. CNAs were paying minimum wage of $7 an hour, and the wages now, as were previously posted, are anywhere from $13 to, I've seen, $18 an hour, and that can be less than high school. So the wages and what's happened in these fields has drastically changed. I remember paying for a lot of people to get their CNA training all the time, and then that's greatly changed, where many of the nursing homes and healthcare facilities now offer the training, and you actually get paid while you're getting trained. And then once you get trained, your wages go up and you have a secure job. So there's been a lot of changes in that field. As you can see on the left, it's a little hard to read the bubbles, but some of the career laddering opportunities are less than high school. Yes, a lot of high school kids get their CNA or work in dietary in different positions before they even get out. Once they get their high school diploma, then you can career ladder up to something else. What's really cool is kids really then get the experience of either a nursing care facility, clinical facility, and sort of find their pathway of which way they want to move and what they want to be, and get to do some job shadowing and learn more about where they want to go. And one thing about career laddering is a person can enter a pathway and have minimal training, and then they go up the next rung, and the training you had in the previous occupation can add on to the next layer and then to the next layer. And that's what's kind of nice about it. If you decide on a pathway, you aren't always starting over. It's like adding on. And then after your high school diploma, then it's kind of up to you. If you want to get a couple years of training and schooling for that LPN, RN, radiology technician, surgical tech, excellent. Minimal time, and you get an excellent paying job, and you can see what those wages are. Some of those wages, a registered nurse, you know, depending on where you work and the shift differential, if you work weekends and nights, it could be $40-some an hour easy. And then from there, if you go on to 4-year degree or even beyond that, and some cool aspects, as I noticed Nicole was saying, there are so many different entry levels and so many different things you can do. So think about other options like community health workers, county nurses, pharmacy, the pharmacy area, medical equipment. We have an excellent program out of the Alexandria Tech where you could go in and fix and repair the equipment. Imagine all the different pieces of equipment that are out there. Diagnostics, phlebotomists, a lot of people start as a phlebotomist, you know, the person that does the blood draws, takes those kinds of things, and then may ladder up into different occupations within that area. Anesthesiologists, you know, if you don't want to be a full-blown doctor, work your way up to anesthesiologist. That's a healthy return on your investment. If you want to go to the next one, well, you can see there, yeah, the different career pathways. So you have what's already been shown, the easy one, the certified nursing assistant, the LPN, the registered nurse, the nurse practitioner, maybe from there, a physician's assistant, and then maybe from there, an actual physician, and all the different specialized areas you can go into, whether it's family practice, oncology, physical, joint specialist, man, it's so unlimited. And I've heard so many different stories of people, well, why did you become that? You know, and sometimes it was from a personal incident or a personal situation or a family member that they needed to have help and couldn't find it, and they determined that this is what they wanted to do so they could help people. One of the main things we do at Rural Minnesota Sep is pay for training. We have a lot of programs. It's like, okay, so I want to get help with it. How can I get help? You can connect with any of your local career force offices or Rural Minnesota Sep if you're in our area to see if you're eligible. We have many different eligibility criteria right now. The dislocated worker, folks who have been, laid off due to COVID, many receiving unemployment may very well be eligible for training dollars. We have youth programs, so kids that have just graduated high school or just got their GED and now they're thinking about getting some training. Anything, we can help typically pay for training. Like I said, we have many different ways to help people become eligible. So I can't encourage that enough because career laddering is great. Talking about the different pathways in the healthcare field is wonderful. But sometimes the first thing people say is, well, how can I pay for that? So there is money out there. There's many scholarships. You want to work with whether it's a student in high school, work with your SEP office. We can also help you determine maybe a good pathway for you. If you haven't decided or unsure, we have some assessment things we can do and help you in figuring out where to go, how long is it going to take you, what's it going to cost, and can we help pay for that? So I guess that's really about all I have. Nicole did a great job, with the career laddering, and that's wonderful. But I think here in the Northwest, we just need to get a little information. I don't know, Liz, if you put any more websites on. That one website, what was it? Oh, I'm sorry. It showed 26 different careers and career laddering, which I thought was awesome. So yes, healthcare is important and many, many jobs, and it's growing and expanding and developing. But if you're interested in something else or you find that's not your thing, we can help you figure out what your thing is. So I thank you for the time.
Yeah, no, and your message is, goes for all of the job seekers. Get in touch with one of our career force locations anywhere in the state, and people like Kelly and her coworkers and my coworkers will help you with all of those details. So thank you very much, Kelly, for being on the call today.
Thank you.
We're going to now hear from two more providers. Tealwood Senior Living. I have Erin Immel on the call today. Erin, are you there?
I'm here. Can you hear me?
Yep. Go ahead.
Okay. Well, hello, everyone. I do have to first start off with, these are some pretty strong acts to follow. I feel like a lot of what I was going to say has, already been very eloquently stated by the three previous speakers. So I won't repeat too much of what they talked about. But I did want to start with just a really recent experience that I had yesterday. And I told the individual that I would be speaking about it, not using her name or anything. But yesterday, I did an interview with someone for an executive director position. I'm the director of HR for Tealwood, so it's customary that when we have these higher level positions like an executive director or director of nursing, that I would be involved in the second interview. So as I was speaking with her, and she'd already been interviewed the first time and they had liked her, and as I was speaking with her, I'm looking at her resume, and what struck me was where she started. So about 7 years ago, she had started as a dietary aide in one of our other buildings, not the one that she was applying for the executive director role. So she'd worked there a couple years and then got into a CNA role. At that point, she was done with high school and she had decided that she wanted to be a nurse. So she was thinking, okay, I'll work as a CNA while I'm going to school. So she worked at one of our buildings up here in the metro for a few months. And then when she went to school at Winona State, she went to our facility in Winona and worked there as a CNA. So she kind of got into a little more in her nursing career and decided that that wasn't going to be the right path for her. And in her words, and it's very understandable, is some of the things that she had to do in her clinicals and also, know that she would do in the future didn't sit well, that they made her feel a little queasy. She felt like she would faint a few times. Nothing about being a nurse. I know that there's people that are not fazed by anything in the nursing profession, and then others, probably myself included, that know that that wouldn't be a good fit. And knowing that is not that it's a criticism, it's that something that you just know about yourself. So anyway, so she kind of took a left turn and decided not to go into a nursing career, and then she decided, I do love healthcare, so I'm going to go into healthcare administration. So she ended up graduating with a bachelor's in healthcare administration. Again, all this time she's working in the different facilities and different roles. And when she graduated, she had to relocate temporarily to Texas, and so she ended up working in insurance. When they moved back to the area, she realized, I still love working in healthcare. This is where I want to be. And so she applied for a marketing position at one of our buildings. And the marketing position is, similar to marketing, in any other industry where you are, trying to, sell your product. You're trying to, explain to the community and the public and clients and potential customers, why they want your product. And in our case, it's why they might want to live in an assisted living facility or, come and get temporary care or long-term care at one of our nursing homes. And so she worked as a marketing director for about a year, and then the opportunity opened up for her to apply for this executive director role. So you can kind of see that in a span of 7 years, she had many different changes in where she thought she was going to go. But it all started when she was a dietary aide at one of our buildings. So I just kind of wanted to share that and kind of show you that that's not an uncommon story. I feel that there's probably 3-4 dozen stories similar to that I could personally tell you about just from being in this company for the last 10 years. And so just to kind of follow up on what the others have already said, that there's all sorts of ladders, there's all sorts of lateral moves. And I can tell you that what Nicole said earlier about once you are working in healthcare, long-term care, you don't want to leave. And so there is an opportunity for individuals to move around, change directions, try something out, and then still stay within the larger umbrella of healthcare. Okay, next slide. So with Tealwood in particular, our mission statement is because the journey matters. And really that's a very broad mission, but so much of what we do is directly tied back to that statement. So the journey of, someone moving into our community, how comfortable is that for them? How welcome do they feel? How educated does the family feel? From how we train our staff to care for those tenants and residents once they move in, to what we feed people, what dining options are available, what activities are available. So the mindset of, you kind of go to this quote unquote old folks home and, life kind of ends is 100% not true. And I know that it's not just our organization, but it's across the profession. That, maybe it's not the mission for everybody, but the journey does matter. And everything that we do comes back to that. Next slide. So essentially with Tealwood, we have skilled nursing care centers, and then we also have assisted living services. We do have some independent living locations that are kind of attached to an assisted living community. We do have this thought and ideology of aging in place. And so what aging in place essentially means is that you might start at one of our communities as an independent living individual where you don't have any services. You just want to live in a community where if you needed help, you could get it. And then maybe you progress to an assisted living community. And, you know, maybe 15 months later, you know, maybe there's some cognitive decline, some memory loss, and now you're in our memory care facility. Or maybe your healthcare has changed that you now are in a more of a acute care, a long-term care setting. So aging in place is really about respecting these individuals, creating this home environment for them, and not looking at it as kind of a progression towards the end, but really aging and living in place. So I apologize for this graphic here. I had just a heck of a time getting our map uploaded yesterday. And so this is essentially a screenshot of where our locations are in Minnesota. We also have locations in Minnesota. So it's a little hard to see, but you can kind of see we go all the way up as far as Little Falls. We also are in Fergus Falls, and then we're down in the southern part of the state in Winona, and you know, certainly much saturation there right in the Twin Cities. And then that far one over there on the left is over in Marshall. So we are pretty spread out, and you know, these are either skilled facilities, assisted living, or a campus setting with an IL. Next slide. Here's our employment site. So for Tealwood, we have an online only application process. When you apply, those applications go directly to the hiring managers. So we have about 40 different buildings. We have an ATS, so that's an applicant tracking system that is not, I think in the old days, you might think of like a sorting system with an ATS. None of the applications that come in are sorted out. They all go directly to the hiring managers, and then they determine based on what is in the application, maybe person's location, their, you know, where they're applying from and what job they're applying for, whether to contact them for an interview. When we designed our applicant tracking system, we did it with the mindset that we want it to be as fast as possible. So you don't need to have a detailed resume. In fact, you can probably apply to one of our jobs in about 60 seconds. We don't require that detailed information because we had CareerBuilder do a lot of research with us, which basically determined that the more clicks someone has to make and the more screens they have to look at, the less likely they will be to complete the hiring process or the application process. So it's very quick. Applications are not disregarded because they're not filled out in detail. It's designed that way. And many positions don't require any prior senior care experience. Essentially, that last bullet there is what we're looking for. We're looking for caregivers. So it's people who give care, people who are caring, people who are givers and want that intrinsic value of doing a good job, you know, and feeling good about it. People can love their jobs at a restaurant or at a store or at a factory, and nothing against those businesses. I mean, we need all the businesses that we have. However, do you have that ability to love where you are? And I think if you go to the next slide there, Liz. So here's the there we go. So here's the main positions that we have. Obviously on the left, you've got all your nursing positions, and those have been pretty well covered up to now. And then we also have community life, which is your, you know, formerly known as maybe activities. We have a lot of people start in these positions. They're entry level. You don't need experience. They pay similar to the nursing aid or home health aid positions. We also have administration positions. I started with this company 10 years ago as a receptionist. I had another job that paid pretty well, but I wanted a second part-time job, and I also wanted to kind of see what was out there in healthcare. So I took this job. I'll be honest, it was $12.48 an hour, and I took it. I didn't know how to make a label. But I took the job, and within the 10 years, I'm now the director of human resources, and it's not without hard work and without going back to school. Going back to school. And kind of some of it's right place, right time. But it is again possible. I will say that there was a comment I saw earlier about, do you hire office staff? And we just hired 4 office managers, and I know that 2 of them had no prior office manager experience. And those both hired between $22 and $24 an hour. So we're looking for the right candidates. We're looking for people that are those caregivers that understand the bigger picture and why we're doing what we're doing, and can be respectful and comforting and supportive. And I can tell you, in the last year, I've been humbled by the staff that we have, because they have sacrificed so much. And they have just come back every day, again and again and again, with their masks on, with their shields on, washing their hands till they're dry. And so it doesn't go unnoticed. And even their exhaustion, when you can see it on their face, they still find smiles for our residents and our tenants. So if that sounds like something you could do, that would be kind of what we're looking for. So you can just flip through. Yeah,
we're going to have to move on.
Yeah, I was just going to say, flip through the rest of these. These are just some fun pictures from some time that we have been in buildings lately. And then I was going to say, if we have questions, but I get it if we're out of time. Here's the way to contact me. That's, again, the employment page. And then our main office is in Bloomington.
Great.
So thank you.
Thank you. Thank you. Yeah, I always hate cutting people off.
Oh, no,
so many great stories. But I know Lindsay Hart of Jones Harrison has some great stories too. So I want you, Lindsay, to have some time.
Thank you. Thank you. Thanks for inviting me. It's kind of fun to follow everyone, because I love to hear all the compassion and the passion that everyone has who works in healthcare. I love thinking of it as not a thankless job. There are so many thankless jobs in the world, but you take care of someone's loved one, someone's parent, and they will never forget you. They will never forget you. So I appreciate that everyone is in this business and in this industry and trying to keep it as compassionate as we can. So Jones Harrison is located in Minneapolis. We're very close to Lake Calhoun, but we're really on the edge of Cedar Lake. So we're in this really unique location. Nobody knows we're back here. So it's nice to have our face out to the world. Our goal is always, our CEO once said to me that we are not in the business of healthcare. We're in the business of giving people peace of mind. Many people are in the business of healthcare, but as a caregiver, you're the person who allows me to go to sleep at night knowing that my mom is getting taken care of. And so we're looking for those kind of people. I've done lots of different training in my life for helping people, job searching over 50, or how to do your resume, or what are the computer skills I need. And so my truth that I like to share is, if you are a human being who can show effort into any path that you want, you will go so far. If you can show that you are looking for the new idea, I always tell staff that if you can just tell me, this would be so much easier if you could just, I always want to know what the answer to that question is. So Jones Harrison has been around since 1888. We were started by women. In fact, there wasn't even a man on the board of Jones Harrison until the year 2000. So it's a very feminine-run building. Now we have plenty of men on staff also, but it's just an interesting history for Jones Harrison. We are also, we're a standalone. We have long-term care. We have assisted living. But we're not religiously affiliated, which is unique to us. So we do a lot of work with inclusion. In our history of leaders, many of them belong to the LGBTQ community. So those are some of the things that we're proud of. You can go to the next one, please, Liz. So these are pictures of our staff, some old. It was pre-COVID, the picture of the staff arm in arm. And the other picture is showing us all gowned up and visored up, and it has been a long haul for those of us that have been in healthcare now. So I've seen on the track of chat there's lots of people wondering how you start and how you get onto those ladders. The truth is you start by asking questions. You call a facility, you call a person like myself and say, how do I get to be a nursing assistant? And that gives me the opportunity to tell you that all you have to do is apply. If you apply, I can either prepay for your CNA license, or if you just got it, I can help repay for that CNA license. There are some waivers throughout the state right now because of this COVID pandemic that we're in to allow us to have you working as long as you're part of training for the CNA position. One of my other suggestions to you is to relax. Everyone you're talking to in healthcare, they are caregivers. You know, our stories are very similar. All of us took a ladder up. I started out as a receptionist at a nursing home in Bloomington. Then I ended up in accounting, and then I was in payroll, and I went back to school with the help of my company to get my degree. So now I am a director of human resources. So the truth is, if you show effort and you call and you ask, the people here are trying to take care of other humans, and that includes you. I think the state of Minnesota does a great job in trying to get people into healthcare, especially into long-term care. They offer scholarships that we facilitate those scholarships, but really that money is sent back to us through the state. So if you can get in and you can get someone to believe that you are trying, that you're going to show up every day, that you care about other humans, you're going to succeed in this industry. I think it's one of the most amazing parts of this industry. So show that you're prepared. A lot of people ask, you know, what if I haven't worked, especially right now? Lots of people are out of work. If you haven't worked, put a little unemployed section. And what did you do while you were unemployed? Did you sit and watch 17 Netflix shows? I wouldn't put that on there. But did you volunteer somewhere? Did you make sure that you could donate to food shelves? Did you, you know, who did you help? Is that when you were helping your mom? Were you the caregiver for your grandma? Add those things to your resume. Your resume does not have to be completely business. It has to look professional, but you can talk about things that you've done in your life that are going to be attributes to that employer. So don't sell yourself short. You really just put out there the work that you do and what you want to do. We have jobs in dietary aides. We have positions as CNAs and PCAs and home health aides. We have positions for every every initial combination you can wonder, but the truth is all you have to do is make a connection. Other people are saying how to even get in. A great idea is to volunteer. If you can volunteer somewhere, that will begin your path. If you have friends that work in long-term care, even showing up to volunteer, you know, deliver mail once a week for a couple months and see if it's the place you want to be. I feel like lots of the paths have already been talked about, so I think that's all. We have positions open now. We're out on Indeed. We're out on all sorts of different job boards and Career Force, and so look us up.
Yeah, and I'll make sure that your contact information is there. So it sounds like, you know, you welcome people contacting you or any of the other recruiters that have been on this call, Erin and Io, correct? Yeah, I received an email from a job seeker from after last week's presentation, and she asked me, well, should I enroll in this training program or this, or, you know, I'm really interested in this location. And I said, you know, honestly, just contact the HR person who had talked in the presentation, talk to them. And it sounds like, Lindsay, you're saying the same thing, you know, or I should say all of the people on the call today.
Yep, it's true.
Thank you. Turning it over to Tom Rice, my colleague, who has been joining me for every presentation here. I am scrolling down to his name to unmute him.
Can you hear me, Liz? I think I did that.
You did. Okay,
Good,
great.
good. All right. Well, thank you. Excuse me. I'll just take a couple of minutes. And first of all, hats off to the presenters today. Fantastic information. You know, it sounds kind of corny, but I've been hanging out with you guys for a long time, Erin in particular. And it brings a lot of pride to me to hear these great stories. I'd like to think some of the people we've worked with over the years have ended up at one of your organizations and are experiencing a great career. So thank you for sharing today, Liz. Thank you for bringing us all together. Thank all of you for participating today. A couple of quick things to say. One is the term service heart. I think every presenter today talked about if you bring what is called a service heart to any experience through healthcare, you will be successful. So it's a great place to start thinking about your skill sets as around delivering services with a heart. I actually learned that phrase many years ago from a presenter from Mayo Health Systems, and have stolen that term and used it many, many, many times since. So consider yourselves the deliverers of services through a service heart. The other thing I wanted to say quickly is that networking is absolutely the key to a successful job search. Every presenter today invited you to connect with them. Lindsay, in particular, was wonderful to hear you say, feel free to contact me and ask questions. Boy, do I second that. Here at Career Force, we talk about that as being a informational session. So consider that as a job search strategy. Reach out to care providers wherever it is you live or want to work, and encourage a conversation to discover what their needs are and how your skills can match. The last thing I get the honor of talking about is from 2 to 6 today on your screen there, there is actually a Metro Region Virtual Healthcare Career Fair going on right now. That's the website you can see on your screen. There are close to 40 employers, all healthcare, waiting to talk with you. So if you were able to spend the rest of your afternoon just building your network, contacting these employers, that'd be a great, successful day for you. So I encourage you to do that. I also encourage you to reach out to us at Career Force. We're more than happy to talk with you about the search and answer questions and support you along the way. Thanks, Liz.
Sure, yes. And so, yeah, I want to thank everyone on these Explore Careers, all the participants who've been signing in. We're going to continue the Explore Career webinar. The next 3 Februaries, the next 3 weeks in February, February 2nd, I'm lining up health insurance call centers, those organizations that are kind of peripheral to health insurance, but work in that call center customer service environment. And February 9th, we'll have a conversation about what it's like to work in medical device companies. Twin Cities especially is known for all of those organizations, those manufacturers. And then February 16th, we're going to shift gears and go over to the irrigation and landscaping fields, a total turn from healthcare, but keep recommending these webinars to friends, colleagues, grandkids, kids, whoever might be interested. Oops, jumping around. Yes, definitely get in touch with Career Force. As Tom says, I'm going to just post this last page here with our emails on it and the Career Force Help Desk and the MinnesotaWorks.net webpage, which is Minnesota's National Labor Exchange. So thank you very much for all of you for attending, for all of the presenters. I'll leave this chat up for just a few minutes, but I'll go ahead and end this session and reach out for assistance from CareerForce in your journey. Thanks. Bye-bye.
Thanks, everyone.